Hi everyone, this is Michelle from the SnooZze again. Okay, so what are we going to discuss today? A couple of weeks back, I posted a question on Instagram as to whether you should increase the CPAP pressure settings further if the patient's AHI is 0.9 per hour. Right? AHI is an apnea-hypopnea index. So, well, I've been asking a couple of people along the way, and well, for most people, they will tell me, no, of course not, 0.9 is very good, what do you want to increase the pressure for? You know, it's good, anything below 5 is good. Well, yes and no, okay. So I experienced this with a patient as well. So patient had been on the CPAP for about just 6 months thereabouts, and all was good. Her AHI has always been consistently at 0.7, 0.9. If I'm not wrong, she never went beyond 1. Okay, so if we look at the pressure curve, right, it used to just touch and go, as in the maximum pressure, right? And because she was unable to withstand higher pressures, it never occurred to me to want to increase her pressure higher than what was just necessary for her. And anyway, because we have remote access, we remotely monitor her progress, so it wasn't really that necessary to set it too high. Right, so in September, yeah, I think about 2 months ago, less than 2 months ago, she sent me a text message. She's frustrated, she's upset, because she said that her sleep was not restful. She wasn't able to get restful sleep. It was frustrating. Her sleep was very fragmented, and she didn't know why. She thought I had made some adjustments without telling her, and I said, no, I did not make adjustments without telling you. And yeah, and when the pressure was just right previously, there would be no way I would lower the pressure, right? So when I generated the compliance and therapy report, and I looked at it, I said, hey, it's still the same, nothing has changed, you know, it's 0.9, it's good. And she said, no, it's not good, something has changed. And I said, okay, firstly, did you put on any weight in the last few months? And she said, yeah, probably just about 5 to 7 kg thereabouts. And I said, okay, but AHI hasn't changed, yeah? Okay, but one thing we often forget is AHI is your apnea-hypopnea index. It doesn't include your RERAs, right? So what are RERAs? Or RERA, which stands for respiratory events related arousals. Yeah, so RERAs do not qualify as apneas or hypopneas, but they do cause arousals, they do cause sleep fragmentation, and yeah, and we often forget that. And what is it, the best or the worst part is that in most machines, it does not, the number of RERAs is not reflected, yeah, on the therapy report. So thankfully, that patient is using a ResMed Essence 10 auto set for her, and yeah, the Essence 10 auto set for her actually has RERAs included, you know, in the breakdown of of all the respiratory events, AHI, your apneas, your central apneas, obstructive apneas, your hypopneas, your RERAs, and Shane-Stokes breathing as well, Shane-Stokes respiration as well. So when I pulled out her detailed data, that's where I saw, hey, you know, why does she have so many RERAs a night? I compared it with 6 months ago when she first started, when she was feeling all good and fresh and didn't complain about fragmented sleep. I compared the two and I realized, hey, well, the AHI is the same, but what has changed is that she previously never had raras, or at the most maybe 1 or 2 a night. And now we're looking at, say, about 10, maybe 10 a night, at least, thereabouts, yeah. Or rather, at least there were many raras a night. So I said, okay, it looks like we may need to try to increase your pressure and see how it goes. And I increased the pressure by 1 or 2, the maximum pressure that is, and I checked with her over the next few days, and she said, hey, thanks, you know, everything's solved. I'm getting restful sleep again, all is good, it's back to what it was at the start, and yeah, no more complaints. So once again, well, it's just a reminder that most of the time when patients go for the review, the service provider will usually just look at the compliance and therapy report, right? And more importantly, they'll just focus on AHI. So if AHI is less than 5, oh, okay, you're still doing well. But patients do complain of tiredness, of sleepiness. We've actually had a few patients come to us for the same reason, that the AHI looks good, but they're waking up a couple of times a night, they're not sure why, and they're very frustrated because they're not getting restful sleep. And I mean, in the first place, that's why they got the CPAP device in the first place, to help them to get restful sleep. Yeah, so it's important to not only look at the compliance and therapy report, which is the consolidated report, the summary report. It is also important to pull out the detailed data to see what you can pick up from there. Yeah, and I'm glad that some of the doctors I work with do appreciate the fact that I do that, because one of them actually mentioned only you would do something like that, to pull out detailed data to see what is wrong. Most people would just look at the consolidated data report, look at it, look at AHI, and yeah, and base it on the AHI, right? As to whether the patient's doing well or not on CPAP. So what do we do for patients that are on their own machines, they're not on the Essence 10 ultraset for her, right? I think that seems to be the only machine that has raras included in the breakdown, yeah? So for some of our patients, what we did is we get them to come back, we lend them the machine, we lend them the autoset for her for a week, and that is more than enough to tell whether raras is the issue. Yeah, I mean, this is just in case you do not want to just increase the pressure without knowing whether it is indeed the raras that's causing an issue. Yeah, but of course, to be very honest, we've also come across cases where patients are repeatedly bringing up that they're not having restful sleep, they're not, or they're waking up often, they cannot maintain sleep. But we have to know that sleep apnea is not the only thing that causes sleep fragmentation, sleep disturbance. I mean, it may be stress, maybe anxiety. There are a lot of factors. It may be diet that actually affects how well you sleep, how well you maintain sleep. Yeah, but what I'm saying is, do not dispel the possibility that you may need to increase the pressure just because AHI looks beautiful. Yeah, if it's because of raras, it's not going to show in your AHI, and patient's going to feel very frustrated because of all the sleep disturbances he or she's experiencing. Yeah, okay, that's all for now. Bye.